Hello viewers, my name is Johanna Cecilia, a 200 level healthcare management and nursing student of the JPTS Institute of Management, Science and Technology in collaboration with South American University, USA, Global Wealth University, Togo, Pan American College, California. I will be presenting a brief seminar paper on the title the attitude of nurses towards relapse prevention among psychiatric in federal neuropsychiatric hospitals. The problem of every hospital when the targeted objective is not achieved is that there is something written either with health caregivers, the patients, or the general public in order to improve the standard of health of the patients and keep them progressively fit. The reason why such relapses are present here to be sought and the remedy made in order to achieve the set objective of the hospitals. This study is based on the attitude of nurses towards relapse prevention among psychiatric patients in Federal Neuropsychiatric Hospital. The aim and the objective of this study are all directed towards bringing out lasting solution to cutting these menace. It also intends to actively involve the management of the hospital, especially on employing new and scientific approach to holistic patient care. Psychiatric illness has fascinated and confounded healers, scientists, and philosophers for centuries. Its symptoms have been attributed to possession by demons considered to be punishment by the gods for the evil done or accepted as evidence of the inhumanity of its sufferers' victims. Thus, explanation resulted in enduring stigma for those who were diagnosed with such disorders. Even today, much of the stigma persists, although it has less to do with demonic possession than with society unwillingness to shoulder the tremendously costs associated with mental illness. Relapse is one of the most severe problems of mental health care givers. Despite the current trend in modern treatment, there is still an alarming rate of relapse and reoccurrence of psychiatric illness globally. Individuals who sought to be productive and responsible in life are wasting away on daily basis. Today's patients are required to stay for a short period of time in the hospital admission and discharge to home environment to help reduce this dependency on the hospital care and reducing relapse. Also, this helps reduce stigmatization and patient replications. The frequency of patients having readmission into the hospital over the last few years has become a problem. This has made the achievement of good control of patients' symptoms and care impossible. Nursing staff and the hospital has suffered frustration seeing the readmission of patients whom were recently discharged home after being stabilized on admission. Some patients relapse as soon as they are discharged home. Others on trials discharge relapse, while others still relapse while on admission. Various factors ranging from financial problems, lack of adequate staff have contributed to the relapse of patients. Some patients have about a day or 2 days journey distance to the hospital, resulting in poor monitoring and accessibility to the mental health service. Other factors also include stigmatization, dependency on caregiver. All these have contributed in the frequency of relapse experienced in the care of these groups of patients leading to the social disability, hence resulting in the following: low manpower, untold hardship, financial constraint, societal noises. If not properly handled and solutions found, the economy may suffer and the society will be at a loss. Apart from the untold hardship, this is what motivated the researcher to investigate the cause, give suggestions, remedy the situation, and also reduce the high rate of relapse. In conclusion, attitude of nurses towards relapse prevention plays a vital role in preventing relapse to occur. Prevention, they say, is better than cure. In line with this statement, relapse, like any other condition, is preventable. Alongside drug therapy, avoidance of stressful situations, and good family support systems, and good preventive measures. Drug compliance also tremendously assists in the stability of the patient mental state. To this extent, the patient is health educated on the need to comply with drugs. With proper management and care, the possible complication that may result from frequent relapse can be reduced as much as possible.